Hi, everybody.
Hey, Jody.
Well, hello, Miss Britt. How are you?
I'm good. How are you?
Good. I'm good. So great to see you.
I know.
I
I'm
am
like,
so,
you're like all the way in Canada. This is so cool.
I know there's a bit of a distance in between us. This is so cool that we can do this.
I know. It's so cool. I'm so excited. I'm going to turn the light on. Let me get another light on. I feel like it's dark. How's your little doggy?
She's good. Actually, she's just napping right now. Otherwise, I'd bring her down.
Oh, yeah. Yeah. How old is she? I need to.
She's 8 weeks old. It's literally like taking me back to having a baby.
Huh. Yeah, you probably forgot all of those things.
Yeah, it's a loose, crazy memory. You know how that goes.
Woo, girl. Roller coasters. Roller coasters.
So, okay, let's dive right into this.
Okay.
We are talking all things paramedical and dark skin today, which is a hot topic.
Hot topic.
And you know a lot of the tips and tricks for dark skin, which is why I think today is such a great live
It
and
is.
so informative. So just to kick this off, let me give a quick introduction.
Okay.
I'm Jody Stoski. I live in Calgary, Alberta, Canada. I have an online paramedical tattoo academy. And we teach the fundamentals of all things paramedical as well as areolas. So, Britt here, I'm going to have you introduce yourself and tell us all about you.
I am Britt. My name is actually Latoya Britt, but I go by Britt. It's just stuck for years. I used to be a teacher in a former life, and most recently, I've been a oncology nurse practitioner for 9 years now. And I decided to transition into PMU just because I felt like there was a need. I wanted more. The full story is I was looking for ways to help a breast cancer patient of mine. Started doing research, found out about areola restoration, started doing more research, found out about stretch mark and camouflage tattoo, and my mind was blown. And I'm like, OMG, like this is
Yeah.
where I really want to be. This is how I can really serve in a big, big way. And so then I opened Skin ATL located in Atlanta, Georgia. And I specialize in stretch mark and camouflage tattoo. Most of my clients, predominantly most of my clientele and the demographics for the area are dark skin.
Yeah.
So I'm your girl.
And I mean, that's a day in your life. So you kind of day in, day out, dark skin, that's your jam, which is
Yep.
what we're going to talk about today.
Yep.
How long have you been doing the paramedical tattooing for, Britt?
I've been doing it for a little over a year now. I officially opened hot smack in the middle of COVID last year in June. That was like when I officially opened, and I had been doing prep and training previously before that. So a little over a year and a half now. It
Very
went by
cool.
so fast. It's like crazy. We're already in 2021 and I'm coming up on my 1 year anniversary. I'm like, wow, here we go.
Well, and congratulations
Thank
for
you. Thank
getting that
you.
business open during COVID. That's a bit of a feat for sure.
Yes, 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 yes. I'm sure you understand. I know I have a lot of like people that I follow, different artists all over the world, and like to watch people go down and shut down and lock down and open back up and trying to manage your clients, and you know they want to get back in, they want to like finish the process and finish the journey. It definitely has been challenging, but it's been so rewarding.
Yeah. Yeah, we are now on our fourth shutdown, which is exhausting.
I'm sure.
Hopefully this one isn't as long. They're saying 3 weeks. I don't have tons of faith in those comments anymore, but fingers crossed that's what it is. I just wanted to shout out a couple housekeeping details. I feel like a lot of people do have questions. So if you do, please drop them below and Britt and I will get to them. We're going to keep this live to about 30 or 40 minutes. And yeah, let's do this.
Let's go.
Okay, so Britt, first off, tell us a bit about what you see day in the life of paramedical tattooing and what your favorite services are.
I offer stretch mark camouflage. That probably is one of my favorites. It's one of the most challenging. And I'll talk about why that is. I do scar camouflage. So I do various surgical scars, breast, C-sections, scars from trauma like dog bites or wounds. I had a client that had she had a childhood cancer that she's now cured from, but she had basically the scars from her biopsy, from her port, different things like that. And as well as recently I started doing lip blush. So I've been taking models in the last kind of month and planning to go live with that toward the end of the summer. So that's been exciting.
That's very cool. I love that you have these services. I think a lot of times when I do these lives, we're always talking about paramedical tattooing being on the forefront of this, and it's kind of in its infancy, and people are just starting to understand the concept.
Kind of wake up and understand what it is. I know I go through like a whole thing when I try to explain it to people, so I just kind of am like, oh, and then they're like, well, what does that mean? So yeah, it's fun to now have like other people and other friends, so you don't have to do so much of the education. Like I will really be glad. It's coming when it becomes like people know exactly what it is. They always go, is that like microblading? And I'm like, sort of, yeah, different, you know.
Yeah. I know it takes a little more explaining. So many people are familiar with PMU. So I know that is a concept that's recognized, but the paramedical is just starting to capture people's attention.
Yep.
And not only that, but just allowing people like us to serve this market of people that a lot of times have no idea that we exist, and it can be that final chapter in a healing journey.
Close, and like to get people like past that thing. Like so many people want to put things behind them, and we've all been there in various parts of our life where you're like, I am done with that. I'm ready to move on. I literally have a client. It's a guy, an older gentleman who has a rare skin disease where his skin is really sensitive to different traumas, and basically if he has a flare up, something will happen. But he has these scars, and he's like, I'm assuming, I haven't asked him his age, but we just kind of like did a consultation. He's in really good shape, like upwards of probably 50s and 60s. And he's like, I'm in good shape. I work out. I like to show my arms off. And I don't always want to have to explain where these scars are from. And I so understand that. I like that resonates so much with me. I told you, Jody, that I had really bad acne as a teenager and as a young adult. And I totally understand what that feels like, to hide and just want to show up, and you don't want your skin or like parts of yourself that you've kind of moved on to like be the story. So I get it.
Yeah, it's pretty remarkable, and it's unlike any other feeling you've experienced. Even like PMU can be so grateful, and especially with things like alopecia, you're just completely changing their world.
Right,
but
yes.
PMU or paramedical is just way beyond that. And I think it is just such a cool thing to not only educate people about, but just get the word out and get girls and guys trained to be able to offer the services. So speaking of services, stretch marks is kind of your numero uno, would you say?
That is definitely like my numero uno. Yep. I think part of it is honestly, like a lot of people that find me have been looking up stretch mark camouflage. They already kind of did research, didn't really know where to go or if it was something that was offered in the US. So they kind of find me. The scar people are just kind of out there. So like that's the other part of paramedical. They'll literally like, I don't know, I ask them all kind of stuff. They're looking up cover up tattoos and ways to cover up the scars, and then they'll kind of come around. So like, as you said, the paramedical part, like that's the part that I really want to push. And, like all of us like grab hold of each other's hands and like get this out here. People will know we exist. Because even people are like, their dermatologist doesn't know, or, they're going to a surgeon and the surgeon didn't have anybody they recommended. So to have more of us in space so people can see that we exist will only help everyone out in the long run.
Yeah, no, absolutely. And it's interesting that you brought up doctors, because I feel like the areola tattoos in the land of not only oncology surgeons, but plastic surgeons, they have that in their head now. They know they've seen good work. They've seen bad work. They know that the receptionist in their office should maybe not be tattooing people anymore.
Right, right.
There's
it
a
needs to be
better
somebody that's really
choice.
trained, and this is what they do. Right.
But it's a really interesting point, because dermatologists, I feel like, have not made the connection. So I see a lot of skin grafts and surgical scars from a lot of those, not only like biopsies, but just things that grew
like
from
needed treatment. Right.
Exactly. And those people are often left with really disfiguring scars, and the derm's just like, okay, bye.
They're like that. They check out and they don't even think about it. And then people ask them, well, what can I do about this? And they're just like, not much. You know what I mean?
Like, it's like when you and I are talking about it, it's the priority of these physicians is to successfully create a skin graft, or to successfully do a double mastectomy, or whatever that looks like. So the scar care and then the scar appearance is beyond
their scope. It's like so second nature to them.
I think there are physicians who are starting to acknowledge this, because I think they realize mentally and physically what it does to them.
What it does to the person. Yep.
Yeah.
It is. It's like I had a client that had a breast reduction, and she was happy with her breast reduction. But then she was like, but now I have these scars, and the surgeon didn't even say anything about those. And she's like, you know, and I'm like, I know it's twofold. Like, their priority is to like give you the results of that part, and the scar part is like so second nature, because they that was really not as part of the training. You know, they wanted to get you there. It's successful. You're healed. Like, they're kind of like, yeah, I know.
Another thing too that I see, and I'm sure this like rolls across your plate as well, is tummy tuck scars. I've had people who aren't even really educated about what the scar will look like. And I personally know a friend who had it done and was completely blown away by how big her scar was. And I was just absolutely shocked to understand that the doctor didn't talk to her about it, and even B, that she didn't do her homework either. But
to get something that big of a I mean, the tummy tuck surgery is a huge surgery where it is, because it's in the abdominal area. But that scar is wicked. It goes most of the time from the left hip all the way across to the right hip. I've seen some different ones, and I'm always like, who's your physician? Who's your physician? I've seen some cool ones where they do a V cut or they go kind of low, but I've seen some wonky ones where they're just like right across, and people are like, well, this is not sexy, and that was not the goal.
Yeah. And you never really know how your scar will look, because you can't predict how you'll heal. You may have an infection. Like, there's a lot of moving parts.
It is.
Yeah, so I think not only sometimes you didn't get explained the whole process, and you don't understand that, but then lastly, there's the moving part that nobody's typically in control of, like how your body's going to heal.
Right, the end result. Exactly.
Yeah. So what is your method with darker skins? Let's talk about hyperpigmentation. I think that's one of the most common questions I get, and I'm sure that is something that you deal with so consistently. So let's talk a little bit about hyperpigmentation.
I require a consultation for a stretch mark or scar camouflage, just because of all of these different factors, especially hyperpigmentation. We both know, but maybe the public doesn't know, that people with darker skin do easily hyperpigment. It's just the way the body responds to trauma, the amount of melanin on board. So I go into detail when I talk to clients about that process, and I ask them, like, have you hyperpigmented? And people don't think about it outside of their face. They're like, oh yeah, but then they'll think about, I'm like, well, did you get bit by a mosquito, or if you fell somewhere? And then they're like, oh, I do have that. So then I just kind of tell them, like, there is a big chance that you may hyperpigment, and it's almost like normal. It's almost like par for the course. So my approach is, I'm always very cautious with the sessions, especially the first time around, just because I know that's a big risk.
Yeah.
And then when I'm choosing colors, me and you talked, I said I generally go a little slightly lighter on the first application.
Yeah.
And I kind of explain it to my clients. I go, we find the color. Once it's a match, I go a little softer the first time around, because in the event that you hyperpigment, you know, the goal is for your skin to heal at the sweet spot, versus if the color is perfect and you hyperpigment, it'll heal a little darker. And you know, granted, most of the time hyperpigmentation heals is just over a long, extensive time. But that's scary if you've paid all this money to get this done, and you were like really, really, really hoping to have this great outcome, and then you are kind of stuck with hyperpigmentation. So my approach is choose a color, go a couple of shades lighter, and then be very cautious on the first application, because people do heal differently. It's not like a one-stop shop.
Yeah.
I do a lot of adjustments when I tattoo darker skin.
And I think it's sort of a marathon, not a race, when it comes to all things paramedical, not even just dark skin. But I think the message here is that being conservative is how we do paramedical tattooing. It's not about trying to get a result and get it all done in one session. It is baby steps. And you know, even with dark skin, there's just some people that I'm sure you turn away. What does that look like?
Oh, I turn people away. One of the things I turn people away is people who keloid, because darker skin people have a tendency to keloid as well. So keloid people I turn away, and I turn away people who look like they have hyper-inflammatory skin. You just kind of know they'll have like dark patches on their skin from other areas, or like easy bruisers. Some of those people are like maybe hemophiliacs, those get turned away. But people who have a history of skin conditions like eczema, I turn those away, just because I have eczema, and so you can kind of trigger a flare up by like any random little thing. So if you are, or if you're hypersensitive, those are like my people: hypersensitivity, eczemas, hyper-inflammatory skin, a history of some type of skin diseases where you were like just sensitive to a bunch of different things, and keloids. Those are like my no-no-nos.
Yeah. What about a hypertrophic scar that's kind of looks pretty mellow? Would you take that on?
So some of those people, like when people have hypertrophic scars, a lot of the times they've already had a dermatologist like address that. So some of those people are like, oh, I had somebody look at it, it wasn't a keloid, it was a hypertrophic scar, and so it's a little raised. So even though with those, I generally don't touch those, because like that scar tissue has already been compromised so much, and it's done so much to try to heal. That's why it's kind of layered like that. My thought process is just, it's like a sweet spot. This could work, this could not work, but it can really make the scar worse. So sometimes I just look at those and I'm like, Or like if you have a scar that's healed, people will say, oh, it's old, but it's like multicolored. I leave those alone.
Yeah. And I think there are people who just, I think, have this idea that they can take everything on, just like, oh yeah, for sure, it's paramedical, I can do that. And even people like with experience still say no, right? And the other thing, I know we talked about this earlier, but the expectation of paramedical clients are not perfection. In fact, they're often like small percentages of improvement. So it's a really unique opportunity for people to not only help heal, but improve these things. And I think if you're really realistic and you've laid your cards out and you're managing expectations, you can really make a big difference in sometimes just like these minimal little tweaks that you could make to a scar or a skin graft or even a stretch mark if they felt self-conscious about those things.
That is the main thing, like managing expectations. Like I'm very transparent in things, and I'm like, you know, I get people who are like, well, I want it to disappear, I want this gone, and I'm like, hey, that is not what I do. I'm not your girl. This like, it looks like magic, but it's not quite, you know what I mean? And at the end of the day, I tell people, like, I'm consistent with how I treat my clients, but like when you leave, there are factors that are beyond my control about how you heal. It's just like having a surgery. Like you can have the best doctor, he can do everything right, and then you can have a little, you know, bump when you get home or something, and it can change everything. But it's the people who are like, well, I don't like the way this looks, I can't get any worse. You're my person. I'm ready to do it. I'm ready for the commitment. Those are the people who you're like, okay, this is gonna be a journey, but I'm here with you, and we're gonna get through it together.
Yeah. Oh, 100%. And I also want to mention the healing time. So we are not like, hey, see you in a month. we're sometimes like, see you in 4 months. So,
yes.
You know, it's the healing process with paramedicals very different. And that sometimes the best results are the ones that
have, like,
yeah,
taking forever.
Like, it's been a year.
It's taking forever.
Changed.
I had a client that it's been 8 months in, and I just posted her photos, and we were like laughing. She's like graduated. She's moved to another city. She's went through 2 boyfriends on me. You know what I mean? And like she came back for her last session, and she's like, "This is it." Like, and I'm like, "I think you're good." And we just kind of like laugh because I feel like I've known her forever because it literally has taken that long. She was committed though, which is, you know, my hat's off to her because it is a commitment. Like you said, this is not instantly. Like, there is no you come in and then tomorrow you can say this happened. This is like, I know we're still healing. It's okay. Calm down. Like, this is to be. I'm always like, remember I said that. Remember I told you that. There's a lot of that. But managing expectations is like top tier, which you have to be able to do, or this won't be fun for either of you.
Yeah. What would you say are your favorite? Let's talk about machines. What's your favorite machine? And then what are your favorite needle cartridges?
I just got a micro, I don't know if I'm saying it right, microbew.
Oh yeah. Which one did you get?
Yeah, I just got that machine and I am in love, and I tried it out. I did lips with it last week, and I tried it out on one of my clients. I was raving about it to her, and she was like, we did stretch marks. She was like, I'm with it, like, try it out. Because I was just saying that I didn't know, and I hadn't tried it out on anybody yet with stretch marks. And she was like, try it out on me. I'm fine. And I was like, oh yeah. And I did, and she told me that she felt like it was a lot more gentle than the previous machine that I had. I have a Mash Dragon Hawk, and so I like that machine too because I'm very used to the foot pedal. So I like that I can like crank the foot pedal, stop and start. I almost feel like I'm driving a car. I'm old school. I like that, and I like the voltage that I can go up. It can go up in smaller increments, and to me, that's important, especially for, I was telling you, for my darker skin clients. Sometimes there's literally a difference between the speed, and if it's like, you know, 4.5 or 4.3, that might be the sweet spot. So those are my 2 machines. I've had like smaller PMU machines that I've tried, but I like the power behind both of those. Like, to me, that's important, especially for darker skin. It tends to be thicker, and sometimes you got to just get in there. And so those right now, those are my faves.
And with scars, on the flip side of, you know, us talking about some of our procedures being really lengthy, some of the things that I find that are polar opposite to that are things like camouflaging a scar. It could be a one and done, and the people are super happy. So
yes, it could be.
Let's hop back to needles. What do you like to use? Do you have a favorite?
My favorite is a 7 mag, like a shader. That's my favorite machine. My needle, I've tried like liners, just because depending on the scars, you know, depending on the size you're looking at, and I feel like when you see it, you're already going like, okay, what needle am I going to use? Yeah. And I have used different sizes, but I just feel like I'm almost like that kid. Like, I have a crayon, or like you said, a paintbrush. I'm just going to turn that bad boy whichever way I want, because it just feels good, and I like how it delivers the ink. I just feel like I know it's getting in there, versus the other ones I'm like, it's not powerful enough. So,
and just to sort of tell people who are not familiar with mags, what both Britt and I use all the time, and I would say this is like across the board for paramedical, and it's not always as common for PMUs to understand the knowledge of this, which is why I broke this down into like a mag 101 for PMUs that want to move into this. But the needle that you're talking about looks like this.
It has, it's flat like this. Yep.
And we talk about using it like a paintbrush.
Yep.
But what also
use it
happens?
Like this. Yeah, you can use it this way. You can use it this way. You can kind of turn it. I love it. It's my favorite.
It's like the universal, just all-in-one needle. Once you get to know how to use them, it's like you can use the sides of the needles. You can do pointillism. You can do whip shading. You can do circular. You can do shovel technique.
Shovel back. Yep. You can do lining. You can do lining. Like you said, you can kind of turn it and use the edge. So That's my baby. I stay with that, mama.
Same here. It's funny because like when we order cartridges, we order them in such big like
bulk
quantities. And I like 7s and 13s, and it's
Okay.
always like there's so many more stacks of those because I just go through
Go
them.
through
And
them?
yeah, oh, because like for me, paramedical is probably about 40% of my business. What is it for
Okay.
you?
I would say it's probably if I'm doing that, it's probably like more 100%. Like, well, I do about 70% scars, maybe 30% paramedical, and now I'm just kind of adding in lips, so that's kind of just waving in there. But
and lips, like when I think back to PMUs that have lips, I'm always like, you'll transition to this easy, like you will transition to lips easy, because once you start using a machine and you get familiar with those techniques, the next thing you learn is just using bigger needles, which is
bigger needles, right? Because when I told you I saw your course, I was like, you're doing lips with Mags? Mags is my babe.
Yeah.
Because now using like the one RL for the lips, I'm just like, oh girl, let's get it over with already. Like, that using that needle is so different from a mag.
Yeah, it is.
It's a big difference.
It's funny because I, right from the beginning, had this type of mag knowledge and started off with it. So when this whole like nano concept came out, be it for brows or lips, I just was really left sitting there scratching my head wondering why, like going back to our painting analogy, it's like, why are you painting an entire room with an eyeliner brush?
With a little skinny bitty brush.
Yeah. You're like, let me introduce you to the paint
to
roller.
This bad boy. Let's paint.
Yeah. So I know that it just takes it to a new level. And this is something body tattooers have been doing since day one.
Right.
And you would never see someone like that, even if they were lining something,
they still manipulate. Right.
They don't even know what those are. I was talking to a body tattooer the other day and I said, a nano needle? He says, what?
He's like, what are you doing that for?
What is the nano? Now, like, they don't even really know what in the world they would use them for. But anyways, it's like different strokes for different folks.
Different folks. Yeah. People like it's your zhuzh, whatever your zhuzh is.
Definitely. Okay. I wanted to just hop back. We got a question or two. I'm just scrolling back here. Britt, while I'm looking for this, tell us about aftercare that you do.
So for aftercare, I tell my clients to ice the area for the first few days, at least 3 times a day. I say like 6 to 9 times, but nobody's doing that. I say ice at least 3 times a day. Wake up, ice, maybe midday, ice just the first 3 days, and then use Aquaphor. That's what I recommend for people. Emu oil as well, EMU, but most people aren't familiar with that, so they don't find that. But I give little Aquaphor packets in my aftercare kit. I also give people like little triple antibiotic ointments, just in case for some reason you see something that looks weird or get itchy. It does never happen, but I like to give people, because I don't want you to get home and start freaking out and thinking something is going wrong, and you can kind of get on it immediately. And then like the main thing is like not to have excessive sweating, because people forget that it is a wound. So you're compromising that area with like excessive sweating, and just touching things with clean hands. That's the other thing. So do you do anything differently?
Well, that's exactly what I do. And the concept of getting something cold on top of anything that looks like it may hyperpigment, and even like with a Fitzpatrick 3, I'm like, you get a scab, does it leave a mark? Like you get acne, it leaves a mark. I'm like, you're gonna
ice that bad boy. Ice that.
Yeah, and I just feel that it's gonna help with that post-inflammatory hyperpigmentation that can happen, and it just settles things down. Like anything, if you you fell and you hurt something, you're gonna ice it, and it's gonna settle it down.
I think it it triggers the body to be like, okay, this is what we need to do. Let's start the healing process. Versus if you just kind of unaddress it and your body has to figure that part out. I'm like, no. Tell that thing that we've done something here so it can start doing what it needs to do.
Yeah. Okay, I found Gemma's question.
Okay.
Gemma. Okay, she asked, do you ladies work with hospitals, surgeons, or just independently? Take it away.
I right now work just independently, but my goal is to get connected with local surgeons and hospitals. So I'm glad you asked that, Jenna, because I want to ask Jody, how did she make that transition? That was a good question, girl.
Yeah, Gemma.
Gemma.
I do work with different plastic surgeons in my city. And it's really interesting. So you have to market yourself just like you market yourself for PMU. You need to get out there, show your work, and start talking to, you might not get past or further than the reception, but
they're very guarded.
They are. So if you don't even need to get through that gatekeeper. You need to show her a photo that will blow her away, and she's going to run and tell that doctor.
Okay.
And that's, for me, areolas is a big one, because a lot of times these doctors have this machine, like a Nouveau Contour or something like that in the hospital, and they're tattooing right away. And so many of the doctors, I have a lot of them in the city, and they'll say things like, those tattoos, I can do one, it's not going to look good, but here's the person who would. So if you're not already linked to them, they send to me. So it's probably half independent and then half
like referrals from your doctors.
Exactly. And I'll work in clinic with them.
Okay.
And so I pack myself and I cruise over to their offices and work there for the day. It's amazing. It's a great way to mix everything up.
Yeah. So it's kind of like you get a different, do you go like a couple of times a month? You have like a set schedule?
Yeah, it depends on, so what happens is they'll get kind of like a backlog of
like people who were interested. Right.
Yeah. And then those mastectomy patients, obviously, like if they had a tram flap and it's not intersecting with my tattoo, they're like, you can go right away. We'll book you next month. And Jody comes here once a month. Or you may need a year to heal before you can see them. So it's this kind of revolving door in a process of getting people. But yeah, I'm always busy with that. So I really encourage people that have the paramedical skills to market themselves. And probably my best tip and trick is creating a lookbook. So a lookbook is sort of a little bit more of a cooler, polished portfolio.
Okay.
And you can, like, one of the sites I use is ZNO, and you can just get these really cool, like perfectly square, like you were going to do an Instagram post.
Right.
And the pictures all go in there. You could write, if you wanted to.
Are y'all taking notes? Are y'all taking notes on what Jody said? Because I'm over here trying to be like, wait, girl, this is some good tea you spilling.
Oh my God, I love it. But yeah, it's like, elevate it, like take it to the next level.
Right. Because that's what doctors want. Like, I mean, when I worked in the hospital, especially those breast cancer patients and people who've been on like the oncology journey and the cancer journey, you are only going to recommend the best for them because they've already been through enough trauma. You know what I mean? They've already got to this point. You want them to win. So like, we're not sending you to anybody shabby especially, a surgeon. Surgeons they think very highly of themselves. After they've done these nice reconstructive surgeries, they don't want anybody to mess up their results.
Yeah, totally. I'm just, we've got a couple more. Anyone near Sonoma County, California? I don't know that. I think I would like to do both medical independently. Definitely, Gemma.
Yeah.
Like you could, the world's your oyster.
Yeah, you can make this thing work however you want to. Like Jody said, that's big because she basically always kind of has an influx of people guaranteed coming in. Versus if you only do it independent, you take responsibility doing all of the marketing and finding the clients yourself.
Yeah, absolutely. And one of the great things about having a lookbook is if you have something that is going to make people talk. They're just so taken aback by what you've done. That does make it to the doctor. And that's how you get past a receptionist or, you know, his director or whatever that person is that you
the
come
office
into
manager
contact.
or whoever. Right.
Yeah, it's very visual paramedical. So
it is, because it's hard to explain, because everybody, you know, you could talk to one person and they understand, and you could talk to the receptionist and she just might be like, well, why would we need that? You know what I'm saying? So I think that lookbook idea is genius, girl. I'm gonna start working on mine tomorrow.
And one of the cool things, a lot of people are like, well, how do I start a lookbook when I don't have any photos? When you go through my online academy, I supply you with before and after photos so you can showcase
somebody
what can happen, because that is tricky. How do you start when you don't have experience? You don't have experience.
That is like, one of the hardest parts. You and I talked about that, especially with paramedical tattoos. The healing process is so long. I post like befores in my Instagram story just so people can get an idea of like this too, and then people are like, well, where's the after? I'm like, girl, we gotta wait.
Yeah, so it's nice to have that as a cushion, because it gets the ball rolling and it gets people talking, and that's how you get that motion.
Yeah, like eventually, like the ball will just keep rolling, and it might not happen in the first meeting or the first week or two, but like 2-3 months from now, somebody will call and say, oh, and that's literally what has been happening too. I did a paramedical tattoo on an actual dermatologist. She had a tattoo removed from like her younger years, a tattoo in an area of her body, and she got a laser and she hypopigmented. And for her, the tattoo was gone, but you could see the hypopigmentation. It was almost basically in the design of the tattoo. So she reached out to me and was like, can you help? And I did, and we did one session. She was good with her one session. I personally, like, you know, people always ask that question, how many sessions do you need? Yeah. And I tell people it varies. It just depends on what your goals are. If it were me with her, with that case, I personally wanted to do 2. I think she needed 2 sessions. She was happy with 1. Like, no, like, I'm not looking for perfection. I like the way this looks. I'm good. I was like, okay, so it, you know, that varies. I tell people it depends on what your personal goals are.
One of the questions I get a lot is, how long does a scar need to heal before you could do that? And my answer is, I've taken cases on as early as 6 months, providing they look healed, which means there's no redness, there's no darkness, there's no purpley or weirdness going on. But conservatively, and to, you know, 99.9% of the people, it's like you need a year minimum. And
somebody just asked that question. Somebody just asked that question under an Instagram post that I had, and I'm the same way. People will message me and say, well, it's been this long, and I'm like, scars are tricky like that. They still change. So, or people will have just gotten a surgery, just gotten lipo, just gotten breast surgery, and they're like, I'm ready to get in so you can fix this part. And I'm like, a year from now, you might not even feel like that, because it may not be that big of a scar a year from now. So I'm with you. I'm always the same. I haven't done a less than 6 months. I had somebody that was like, it'll be 9 months. I'm on, you know, those are a little different, but like, I'm with you. A year is you need at least a year just to give your body time to heal and to see what the actual scar looks like. Because for us, we need a baseline. So if it's still healing, if anything happens, there's no way to compare, because the scar was still healing.
Yeah, totally. One of the plastic surgeons I work with, he tells his clients 6 months. And I'm always like, no, we have to wait longer. Tell them a year. Of course, there's the exceptions, like with cram flaps and sometimes scars that have been blanket stitched because they are so fine
on the inside.
So those often can hit that month, but it's like, let's consult, let me see it, and move on from there. Okay, we have another question. How does this look for people? Sorry, how does this look for people? Oh, I think how does this look for people after it fades or has sun exposure?
That's okay. Go ahead. I'll let you answer. Go ahead.
This is a super popular question. So sun exposure affects the epidermis, not the regular dermis. So the melanocytes come up, and this is the layer that is always shedding off. Your tattoo is in the dermal layer. It's not in the epidermis. So this is a very sturdy, good place that will have the longevity for it to last. So as your skin may change color from the sun, this stays in place. So these tattoos, they not only tend to not fade, but they're there for good. I think there's, depending on the ink that you use, there's different scenarios, but typically the sun does not affect them. I still recommend sunscreen, just like you would on anything, because sun damage is sun damage. But the tattoos implanted where they're supposed to be are stable, and they stay there, and they don't muck around and change colors. One of the other questions I get a lot of too is colors with iron oxide in them. And most of the ink that I do use, it doesn't have iron oxide in it. Now, if I'm adding white, which is iron oxide, it's a very small amount. You're not going in with a whole white and you know, blanching things out or whatever. So those are some of the key factors when it does come to that sun exposure, which honestly, I get asked that question all the time. Do you have anything to add to that?
I always tell people, especially with, I think people are always thinking about tanning, like, well, how will this look when I tan? And for stretch marks, for sure, and even with scars, like generally the healthy skin around the stretch mark or the scar gets tan. The stretch mark or the scar, so that like the contrast then becomes so different. But I tell them, once you get this camouflage, there's less of a contrast, so even when you tan, you don't see that contrast variant, and the tattoo, like you said, doesn't change because it's in the second layer of your skin, it's in the dermis. And so even when your skin gets darker, the healthy skin gets darker, you don't see that big of a contrast like you did before the camouflage. And then when your tan fades out, now you're back to all even skin. It's so minimal after you get the tattoo that you don't think about it like that, because people are very self-conscious about tanning when they have scars or stretch marks, because it's almost like the sun brings those bad boys out. And it's not the case anymore after the camo.
Exactly. I think one of the main things just to wrap your head around is that scars don't tan.
They don't tan.
So when you camouflage them, they're still not changing.
They're still not tanning. They're not tanning still.
But somehow I think when people are like, well, if you're putting ink in them, like somehow is that going to change with, you know, sun exposure or being on a hot holiday? And it's like, no, it doesn't. No, so
it doesn't.
It's always something I find that I'm clarifying, and I'm sure you are as well.
Yeah, that's like I always cover that question, because people are already thinking about the next thing. Once they find you, they're like, okay, after this is done, when I get ready to do these things.
And it just, I find too, it's kind of like Pandora's box. People are like, okay, I had these self-harm scars that I want taken care of. And then it turns into their stretch marks. And then it turns into, you know, this
little thing here that
I had this mole removed. It left a scar. And it's, it's pretty cool that way.
Other things too. Just da.
Yeah, for sure. Well, okay, Miss Britt, I just want to thank you so much for joining us today.
It was so fun.
And taking sort of the mystery out of some of the darker skin procedures that I think can be approached with caution, just like you would on lower Fitzpatricks. But, you know, still being able to provide those services to people. So,
and for people with darker skin to be to feel included, because I get a lot of clients who have been wanting to try different PMU stuff, paramedical stuff, and they're just kind of like on the fence because they don't see it being done. So us having this conversation and sharing tips and just making people, spreading awareness about it, hopefully like the other paramedical artists will kind of like step up and include everybody, because the goal is for all of humankind to feel better about themselves at the end of the day.
And not to have to say, I'm sorry, I can't do this for you because your skin is too dark.
Skin is too dark. Because your skin is too dark. If you tell people, I say that it's probably going to take longer to heal, but if you are here and you're patient, we can make it happen.
Absolutely. One of the last things that I just wanted to touch on is, if you are a PMU and this conversation with Britt and I has sparked some interest, you want to go and start building fundamentals in paramedical. So check out the Jody Stoski Paramedical Tattoo Academy. We absolutely love and are very invested in giving good training when it comes to paramedical. It is one of the most important things to get started. And yeah, we would love any questions or for you, of course, to become one of our students. So I, again, want to thank you, Britt, for
Thank you, guys. Thank you.
joining.
And if you want to keep this conversation going between me and Jody, DM both of us. Ask questions. It always helps. Like knowledge is key. And Jody and I we've already kind of chit-chatted and discussed about this. Like, we like when people get asked questions because we want to help and inform everybody. So don't be intimidated. Don't feel like I shouldn't ask this. There's no way to know what we don't know if we never ask. So
and okay, Britt, where can people find you?
I am on Instagram at SkinATL, SKYNATL. My website, www.skinatl. And you can always email me, hi@skinatl.
So you definitely want to give this hot mama a follow because her work is not only incredible, but it showcases dark skin, which I love. And it takes
if you're not dark and you don't have dark skin, send it to the people that you know, because there's always somebody that's like, okay, well, maybe, you know what I mean? Even if it's not you, let's just let everybody know that there are options.
Yes. Yeah. It's like we can provide these services to almost 100% of the people instead of really like shrinking it down and saying, I'm sorry, there's, I can't help you. Most of the time we can help you. So
most of the time.
Yay. Okay.
Yay.
Thank you again. Have a wonderful week. And thank you for everybody that joined. Again, if you have any messages, DM either of us, and give Britt a follow because she is the best.
Thank you. Thank you, guys. Thank you, Jody. Good night.
Take care.
Bye-bye.
Bye.